Implications for learning. As a child care provider, you should always be on the lookout for signs of developmental delays and be aware of appropriate methods of dealing with children experiencing developmental delays. You may use the knowledge about the principles of child growth and development to spot the child who is not yet showing the skills and behaviors we would expect in a certain age range. Certain aspects of development may be slowed or non existent depending on the child. Just because a child may be developmentally delayed in an area, it is important to continue to help the child develop as much as possible in the area in which he is delayed. Developmentally appropriate practices for this child may differ from those expected for the child's age. Include the child in all activities in which he can safely participate. Increased supervision or attention may be required to ensure safety and well being. Such a child may also be in need of professional help such as speech therapy, vision correction, physical therapy, or hearing aids. It is important to remember that we should not diagnose children. If you have any concerns regarding the growth and development of a child, the concerns should be presented to the appropriate party. Key point. The skills and behaviors generally typical for children at a certain age range may not be possible for some children who are developmentally delayed. Implications for learning. Now let's talk about the Americans with Disabilities Act. Passage of the Americans with Disabilities Act in 1990 sent a clear message to the American people that children and adults with disabilities are entitled to the same rights and privileges that others enjoy. This means that children with disabilities are legally entitled to equal access to community based child care settings. However, a legal mandate by itself is not sufficient to make available realistic and responsive childcare options for children with disabilities. Although the picture is improving, families continue to have difficulty finding inclusive childcare programs for their children. Activity. A child who is physically challenged, a child wearing a leg brace. Ensure learning centers have ample space for movement. A child who is socially challenged, a child who has autism. Reduce number of transitions throughout the day. A child who is shy or emotionally challenged. Ensure the environment feels safe for the child, a child who is gifted. Provide activities that are slightly challenging to the child, a child who is mentally challenged. Provide activities to increase development without causing frustration. Key point. Children with disabilities are legally entitled to equal access to community based child care settings. Key point. Child care professionals may spot developmental issues before the parents do. This is why it is important to understand the basic child growth and developmental principles. Now let's come to child growth and development.